From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning and welcome to Medical Forum. I'm your host, Jeff Reed, with my co-host, Chris Marr. Thank you all for all joining us. If this is your first-time listener, we talk about all medical issues, I guess, that go on around the Sumter, Clarendon, Lee County. Been doing this since March, and today's guest we're going to have on will be Kim Price, and might even have Jeff Fall stepping in here representing Tuomey, and it'll be a great segment that we'll talk about anything ranging from kind of the flu epidemic, how they've handled the storm, obviously all their charitable things going on, especially with the holidays coming up, and we'll talk about some of the ailments that people talk about. But Dr. Marr was fun last week with Susan Humphreys.
Yeah, great guest.
Enjoyed
learning about massage.
Have you been?
What she
Did
has.
you go?
I have not been yet this week. No,
you canceled.
No, yeah, that's right.
Did you cancel?
Yeah,
I did. I went. Fantastic.
How was it? Able to do 60 minutes?
The whole words 60. Do not describe. No, it's awesome. It was very good. We'll talk with Kim, see if she's gotten a massage in the past, or maybe even Jeff Fall can echo on that. But I will tell you, since you have not, and we're both kind of pingers. Can we call ourselves pingers?
Yeah. 60 minutes, I just don't know.
I'm just going to tell you what happened. The first 30 minutes, I was kind of the pingy, And like she talked about, you start with your head down into the little pillow. Man, it was great. It was great, and an hour goes by, but you feel good. The next day, you kind of feel like, wow. I mean, something's going on there. But no, it's great. And she's a good friend of the shows, and also Central Carolina with her training in the background. So I want to thank Susan for coming on Sumter Massage Therapy. She was on, catch her and Sean McGrew, 504B Miller Road, right across from the Y. Give her a call, 774-4333.
I think it's interesting. She was talking about her education at Central Carolina, right, and talking about the programs that they have there. And actually, since we've had the show in the last week, I had a patient who came in and was telling me about them going over and having a massage with the students who are there now, and said it was fantastic.
Well, Kim had mentioned when we walked in that she felt like maybe what we do is give complimentary massages out to our guest. So we'll talk to Kim about that later.
She said 30 minutes or less, though, right?
That's right.
That's right.
I'm trying to remember this conversation.
Yes. Well, Kim, thank you for coming in. And Kim Price, of course, head of Tuomey with Home Health and Hospice, does a variety of behind the scenes, including Spark, which we'll talk about, and of course, very active with the foundation and helping raise money for Tuomey. So, Kim, thanks for coming on.
Glad to be here.
Good to see you. And since we're finished, have you ever had a massage?
I have had a massage, and an hour is a long time.
Well, you're a pinger too.
I am a pinger.
Okay. So you've joined the ping class.
Yes, and I like to be busy, but I did make it through. I've had two in my lifetime. I've had two, so and I enjoyed both of them. I will say I was a little tired.
Yes,
in the end.
This is the feeling I'm trying to demonstrate. Afterwards, you do kind of feel like, wow, not beaten up, but you feel like you've been worked over.
Relaxed. Which is not usual.
Well, speaking of relaxed, reading in the newspaper about a week ago, 10 years, lawsuit, Tuomey Hospital versus our federal government, an IC settlement.
Yes, sir.
T's crossed, I's dotted.
Finished. It is over. Yes.
It's a walk-off. Everybody go home.
It is.
Now, this is awesome.
It is.
I know that now comes the rebuilding. Now becomes the unknown factor of what we do from here. Palmetto seems like this is the option. That was the one, segment that was holding back the whole deal.
Right. We were waiting to seal the deal, if you will, with Palmetto. The federal government wanted that piece completed, everything done, I's dotted, T's crossed, for the settlement. And we were able to, Michelle Logan Owens was able to sign the papers. I believe it was on a Friday because, while we are not happy that the whole thing took place, you don't necessarily call that a win by any means, but it's over.
Right.
It is over. We can close the door, put it behind us, and we can move forward, which we have been waiting to do for
no win, no loss is a settlement.
It is
what
settlement.
it is.
That is what it is. And I will tell you, it was an emotional day for us because many of us who have been there through the whole thing, I mean, you almost get to a point where you just wonder if it's ever going to be over and whether you can even grasp that it actually is. So there was tears and celebrations, and I still get a little emotional when I talk about it because it has really not just plagued the hospital, but this community. It's tough for all of us to have that hanging over us. So it's behind us. And when we did SPART last week, I said that, and I said from now on we will only talk about partnerships. We will not talk about lawsuits. So that was
very
the
good.
end of it.
And Kim, background, how long have you been at Tuomey?
19 years.
Yeah. Mm-hmm. So you're about I think we're in our 10th year of this lawsuit, or finishing up, give or take. Dr. Moore, you got
how many trees? How many years have you decorated trees that you've survived dangling from the top of the gift shop
with care?
Yeah, because I was really worried about you when we talked last time.
I would guess.
I thought about you several times.
Somewhere between 8 and 10. I mean, who's counting? But it's just my life.
For those listening, Kim was on about a month ago, and she explained to us, and we will talk at the last segment about the trees that decorate Tuomey. It's a beautiful, beautiful surrounding for anyone coming up. They'll probably get decorated towards the end of November after Thanksgiving, and coming in and looking at the trees. It's beautiful in there. But Kim's very instrumental in decorating the Tuomey tree, which we'll talk a little bit at length. But Chris and I were nervous. I mean, was that a word?
Yeah. On a ladder on top of the gift shop.
Mm-hmm.
No.
15-foot tree?
Correct.
15-foot tree? At least.
Yeah.
Branch by branch.
It's impressive.
Stringing lights.
It's impressive. I still think it's impressive.
Who still has to string lights on a tree?
Who's got a 20-foot tree? Let's start with that.
It would be very heavy with lights on it.
Now, you gave some credit to somebody else helping you last time.
I had a lot of help last time. My mother, Jeff Fall.
You got your mother up there, too?
Absolutely. Well, I think if I remember right, Mom was handing me ornaments for me to put on from down below. But we had Jeff Fall helped last year. Shaw Air Force Base helps every year.
Did you get Ackerman out there at all?
Probably to heckle me and give me a hard time as he passed by and watched me work.
He held the ladder.
Sounds about right.
Yeah.
Les Thompson helped last year.
Good.
And the Foundation girls are always a great help.
Well, this is going to be a good segment when we talk about that, to follow up on it. But, hey, we're coming up on a break here. I want to thank Kim Price, as always, and Tuomey, and all the great work, and a special congratulations on this last month. It's been a trying time. Anyone who's been in the medical industry the last few years has certainly felt the effects of it, if nothing else, just like you said, the unknown. And as we come up on our first break, I want to thank Bynum Insurance, as always. Hey, go by and see them. Right now is the time. If you are a Medicare, if you're turning 65 or you are 65, you need to get in there. 469-3030, 1170 on Wilson Hall Road. Karen Schwartz will vector you through all the insurance plans, but there's so many HMOs out there, you'd be a fool not to.
Don't forget the Medicare Part D. Don't forget the Medicare Part D, which is the prescription drug coverage. And like Karen said when she was on the show, if you don't get it, you're going to pay a penalty at some point.
And we'll be right back with Kim Price.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
At Your Service Home Care provides in-home personal care, including light housekeeping, bathing and dressing assistance, medication reminders, meal preparation, companionship, transportation, and assorted other assistance to continue living safely and comfortably at home. At Your Service Home Care works with your local home health, hospice, Alzheimer's and VA programs, and other providers in the Sumter, Clarendon, Lee, and surrounding areas. Locally owned, At Your Service Home Care is here to ensure you and your loved one continue to live your life with dignity and respect. At Your Service Home Care, 1250 Wilson Hall Road, Sumter, 803-607-9677. Please call, stop by the office, or visit www.ays-homecare.com and let them know how they may be of service to you and your loved one.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with Medical Forum. Thanks for joining us this Saturday morning. Remember, if you miss any part of the show this morning, we do re-air on Sundays at 2 o'clock. And you can pick up any of the broadcasts then. If you're interested in any of our prior shows, you can visit our website at Your Service. It is www.ays-homecare.com. Click under Medical Forum, and there is audio files of all of our old shows, so if you're ever interested in a certain topic. We'd like to thank our sponsors today, Reliable Medical Equipment, 246 Broad Street, right down from Colonial Family Practice. Go over and see Richard for any of your orthotic or prosthetic needs, or Aubrey for your respiratory needs. Again, stay local. If you have problems, they can take care of you. It's better to have someone locally than trying to vector through mail order companies and things of that nature. But go down and see Reliable. I assure you, you'll be taken well care of. The number is 934-9212. And we're talking with Kim Price today, and one of the discussions we've had on every show for the past several weeks is the impact of the flood, what it's had on Sumter and all the different companies and how we've vectored through it. I know at Colonial, on that Monday, we were all just trying to figure out what offices we could open, and I think we got urgent care open by maybe noon or 1 o'clock, and I think it took us all about an hour or so to get into town. And how did you guys do at Tuomey Hospital?
Well, we did great, to be honest with you. I was so impressed with the staff and especially with their attitudes. You know, many of the staff that were there during the storm were not allowed to leave.
Talk about that, Kim, because that's something that a lot of the hospitals had to implement. Is it a code or a certain, not like a code red, but it's something where you can't leave your post until your replacement comes, essentially. Is that right?
Well, we were in a code yellow,
okay.
So an external disaster. You know, obviously there were no fatalities or anything like that, but you don't know that your staff that is set to come in can come in. So a lot of times your relieving staff is not able to relieve you. And then the other thing is that when you leave your post to go home, if your first responders are out trying to rescue folks from their home, and then you add to that, so then now they're having to rescue our staff who got stuck on the way home.
Right.
I think, and I'm not 100% certain, that they even asked, you know, if you have people there at the hospital, keep them there. So we did, and there are many people that pulled double shifts. As people were able to get into the hospital, they did come in and relieve those people. We had home health staff show up, and I have to brag on them a minute. I want to say I counted 9 home health staff that showed up at the hospital to help the hospital staff units, which is amazing. Most of those home health nurses have come from the hospital to home health, so they have a history of working there and can help. And a lot of times when a storm like that happens, we are not able that first day to get out and see our patients. We categorize them, and there are patients we have to see and some that can wait till the next day. So we had two nurses, seeing patients in the community that absolutely needed to be seen, and the others were at the hospital. We staffed a daycare for our staff.
You helped Sumter Rehab. They talked to us about that. Maybe talk to that. I mean, for anyone that so we're Sumter Health and Rehab right there on Miller Road.
Correct.
As you come, let's say you're leaving the Y and you're headed towards Shoney's, you'll pass it there on the right. I went by there on a Monday, and the water was completely up a car length. In fact, they had to get the patients out in boats.
In the hallways.
In the hallways.
It's just
terrible.
Unbelievable.
Tuomey steps in and maybe explain that, Kim, allowing them to move their facility and house with you until they can get it up to par.
Right. The wave of healthcare right now, with all of healthcare shifting towards post-acute and not inpatient stays, we do have a few units that are not open right now. So we were able to provide 2 units for them to move their patients to while they were with college. They have done a phenomenal job of doing. They have had crews in the hours of the day by the numbers full.
And Kim, I think it was a year ago, you and I went when they opened the facility.
Right.
And they'd put hardwood floors, beautiful facility.
Brand new.
Gone.
Brand new.
Is that the part?
Yeah.
I think it was the whole
damaged?
thing. Yeah.
Yeah.
Because it was the
front
rehab
building.
site.
The front building
took
that
the
faces
brunt of
Miller
it.
Road. Yeah.
The back building, I think, is a little higher.
But I just think that speaks to me, and we always preach about staying local when you can, and that's extending out. What I know that you also with the Bernie Hope facilities and Sumter High and some of the other
Bernie Hope and Sumter High were your typical shelters for folks like you and I who had some damage, were not able to stay in our home, but were healthy.
right.
Tuomey opened up the special needs shelter at the hospital. That's for like your oxygen patients, your tube feeders, patients who aren't able to go to a regular shelter, who can't, do their activities of daily living, need help going to the bathroom, ambulating, that sort of thing. So we had special needs shelter for that. Tuomey manned it to begin with, and then DHEC came in and took over and manned that shelter for us.
I bet your ER was a zoo. It maybe not. The one thing about this storm that maybe differentiates, and with me owning reliable medical equipment, we have, Kim, probably close to 300 people on oxygen. Mm-hmm. So when you deal with something like a hurricane, we always emphasize that if you lose power, because remember the concentrators run off power, they all have a portable, but that gives you a finite amount of time. And where they head once they lose power to the emergency room so they can get the needs that you've discussed. I think most, even though the flood damage probably when it all spits out will do every bit as much dollar financial damage as Hugo. But I don't know that a lot of people lost power for a significant time. Now, I know people on 378 that lost it for a day and a half or so. But for the most part, did you lose power where you are?
I did not lose power.
And we didn't either. And I'm over by Sumter High. Chris going out by Bacala Springs and such. So I think that's the one advantage that maybe the ER not being overwhelmed too much, but I'm sure it was.
Without the loss of power, it really, even the special needs shelter, we had people come and go, and they were mainly those that lost their home, had to evacuate their home, and they were oxygen patients, had a couple hospice patients, that lost their home, lost their oxygen concentrators.
Yes.
In its entirety, not just the power to operate it, but it was gone, floating.
Yes.
Nowhere to be found.
Yes.
So it was a little bit different from, when the power goes out and everybody has so many hours of oxygen and then they need somewhere to be.
Mm-hmm.
But sad, too, to see the people that lost their homes that have been there forever. Yeah. But the reality is everybody was in good spirits given. I have to commend the Sumter community for, I didn't see a lot of tears. I didn't see a lot of woe is me's. I seen a lot of I'm alive and I can rebuild that. So it was great. I spent 37 hours straight at the hospital. I did sleep because the road that I came to work on, within an hour or so of my coming to work on it, the bridge was out. So I couldn't get back home. And by the time I could get back home, it was dark outside, and I wasn't going to try it, not knowing, which way I could go to get there.
Well, like you said, the governor all but said everybody stay off the roads will arrest you. But she's Kim Price. We're coming up on a short break here. When we come back, we're going to talk about some of the issues that all of us need to be aware of as we start getting into that flu and cold and flu season, and some of the misconceptions and some of the things that people should take from a precautionary. But we'll be back with Medical Forum. Kim Price. I'm your host, Jeff Reed, with Chris Marr, and we'll be back right after this.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports, WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
I was Daddy's girl. He was my guide, confidant, and friend. We cooked out, fished, and talked about everything. He has trouble remembering those times now. I'm the parent and caretaker to my dad. He does remember losing his dignity each time he needs my help with simple daily care. Calling At Your Service Home Care was the best thing I've ever done for my dad. His personal attendant provides assistance with bathing and dressing, a compassionate presence for his safety, and even travels with our family. Having At Your Service Home Care working with me now gives my dad his dignity, and I can enjoy just being his daughter again. The wonderful people with At Your Service Home Care have the gift of caring for your loved one. If you have become the caretaker to a parent like me, contact At Your Service Home Care, 803-607-9677. Located at 1250 Wilson Hall Road in Sumter, or visit the website www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
And welcome back. It's Saturday morning, as Chris mentioned at the last break. If you want to catch some or all of the show, we will re-air on Sunday from 2 to 3. Guest today, Kim Price, heading up Tuomey, doing an assortment of things. Kim wears many hats, home health hospice, works with a foundation, and as we found out, spent 37 hours with just a little sleep during the flood at Tuomey. So hats off, and we've talked about the flood, and I think you hit it right on the nose, how great the Sumter community is and the spirits they have. And as we come back, we also want to thank At Your Service Home Care for being our presenting sponsor. 1250 Wilson Hall Road, 607-9677, or catch him on the web, www.ays/homecare.com. Guys, we're getting into that season. Thanksgiving's going to be here, and we're going to talk about some of the happenings with Tuomey in December. And it seems like every commercial, in fact, I listened to 105.9 the other day with Mr. Derek Burris, and talking to our friends at Sumter Cut Rate, old Doc Holliday, and he's talking about flu season and strands and this and that. Should I get a flu shot? Am I giving myself the flu? Dr. Marr, let's talk about flu shots. Do we do them?
Absolutely.
Okay.
Without question.
Anything we need to clear up on that?
Well,
or just talk to us about, why do I need a flu shot? Am I sticking a needle in my arm and giving me the flu? Am I going to get sick?
So
what's a misconception?
The injectable flu vaccine is a dead virus. There's no live virus in that. You cannot catch the flu from the injection. You can, however, get a inflammatory response for the first 1 to 2 days afterwards, maybe a mild headache, maybe some body aches, maybe a low-grade fever of 99, which is just your body developing its immunity. Okay, so that's just the inflammatory response from your arm might be sore for a day. Mine was sore for an evening. But you cannot get the flu from the injection. It's not a live virus. Now, Kim and I were talking on the before the show about the nasal flu mist, which is a live virus. It's actually a live attenuated virus. You cannot get the flu from the nasal mist, but you certainly can get a more severe inflammatory reaction. And there's a lot of other concerns with the nasal flu. It has to be given to healthy, younger individuals without respiratory problems, without asthma. And a person who gets the live flu virus as the nasal spray has to be careful about being around other individuals, particularly immunocompromised individuals, maybe cancer patients, patients who are on medications, or going to the hospital. And I would imagine that Tuomey Hospital has some recommendations about not visiting patients if you've just had the flu mist, which is the nasal spray, because that can be transferred, actually.
So we can get a shot or a nasal?
Or a nasal mist, yeah.
Kim, what do you see? Let's talk about Tuomey. Does Tuomey have any regulations about people getting a shot? Have you had a shot?
I have. I had my shot yesterday.
You did?
And I did not get sick.
Okay.
And I feel great today.
And your arm doesn't hurt?
My arm, well, I had to feel it when you said that, because last night it was a little sore.
Little sore.
My son gave me a hug last night, and I said, oh, that's a little tender. But today, no. Arm's not sore.
Home health,
sick.
Hospice. You both are home health people and hospice people. If I am on hospice, because I always hear the people that really need to get the shot. I think we all do. But for the most part, people that have weakened immune systems or compromised age, things like that. Home health people, hospice patients. Is this something that you guys recommend? That if you're a hospice patient, and I understand hospice.
I'm going to tell you my opinion about that, and to kind of think a little bit broader about it. I think that getting the flu shot, you're protecting yourself from getting the flu. But Jeff, if you or I get the flu, we're going to be down for a couple of days. We're going to feel poorly. But if someone who has a terminal illness gets the flu, or a young child less than a year old gets the flu, it could be life-threatening. So whether we give a hospice patient the flu shot would not be out of the realm of possibility. But more importantly, all of those who are coming in contact with that hospice patient should be getting the flu shot. Gotcha. All of those who have a family member at home who has chronic illness, they're taking care of someone who has cancer. What's probably more important than that person who has the illness, who's staying at home, not being around anybody, is everybody who's coming in contact with them getting vaccinated. Because you can get the virus before you become symptomatic.
Gotcha. The Colonial Family Practice, you can get a flu shot there. Is that
absolutely
correct?
Just walk in.
Just walk in. No appointment?
No appointment.
How much it cost? It's
free.
Sure. Yeah. It's free. If you go in and say, Dr. Louder, it's free.
Now, I'll tell you, with most insurances, it's
probably $25.
With most insurances, it is free.
Dr. Marr just has to check the box. Flu shot.
The variability of coverage changes based on your insurance. So some insurances cover it at no cost. Some insurances don't cover it at all.
Or Affordable Care Act insurance might do that as preventative. I wish Karen was here to answer that. So go give her a call at Bynum at 469-3030. Yeah, because it's true. But I think you both, being in the medical field to the extent you do and see patients, Dr. Marr, you see the patients that might come into contact with Kim, some of your hospice patients possibly, and you want them as protected as possible.
Correct. We do. We encourage all of our employees to receive the flu shot. Physicians, employed, nurses, techs, food and nutrition. Tuomey does provide the flu shot to all of their staff, volunteers, retirees. On to the length yet of saying you get a flu shot or you wear a mask. There are healthcare systems that have done that. That is the wave that, from October to May. Start
a little bit earlier, right?
I mean, we saw some cases of flu last year as early September.
Right.
And then we had that wave where it normally is over, and towards the end of the year we got this another little surge almost in springtime. So there's just the season's variable every year.
You mentioned youth, kids, children. Do you recommend children under a certain age not get a flu shot, or is there any age?
I think younger than 6 months, I don't believe they can get it. But
Correct.
6 months and up, they can get the flu
So
shot.
from 6 months to now recommended. So the misconception that you're giving yourself the flu, because I know a lot of very intelligent people who feel like that. And, you know, I'm not going to give myself the flu. That's the dumbest thing I've ever found. But like you said, minimum risk, and the risk might be very, very short term. Sore shoulder, maybe in your case, sore arm in your case, Dr. Marr, but highly recommended. Does Tuomey do health, shots? Is that something that if you drop by an emergency room or you came in, Dr. Jansen and then probably offer that?
They do.
Dr.
All
Ridgel?
your physician offices, I would think, offer the flu shot. I'm not sure whether Tuomey is doing to the public. Letitia Pringle is our expert on the flu shot. She is the infectious disease administrative director at the hospital, so she knows all those answers.
Gotcha.
We do for all our employees.
And she's Kim Price with Tuomey Health System, 774-9000, 129 North Washington Street. Of course, you can catch Kim over off Pinewood Road. And that number, Kim?
803-773-4663.
And we'll be back with more happenings at Tuomey.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Brooke Luce, Admissions Director with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we're back with Medical Forum. Appreciate everybody listening in here on this Saturday morning. You can also catch us on Sunday from 2 to 3. And for those of you just joining us, Kim Price here from Tuomey, representing the Home Health and Hospice and Foundation and doing so many things for Tuomey for 19 years now. And, of course, the expert in doctors of all doctors, Dr. Chris Marr. But we're talking about a very serious topic that is very poignant with the time of the year. And where we left off, we were talking about flu shots and some of the old wives' tales of flu shots and the importance. I think we've all agreed that a flu shot is a necessary approach to staying healthy, especially if you are someone who's a caregiver or you're around someone whose immune system is in question. Last thing we want to do is get them sick. Is that right, Dr.
Yeah,
Marr?
protect those around you. Think about it as protecting those around you.
Yeah.
You know, I'm exposed to the flu so much. Part of me wanting to vaccinate myself is to keep from taking it home to my family. And so, you're not only protecting yourself. Yeah, everybody. Yeah. So you're not only protecting yourself, you're protecting those around you, because it just spreads like wildfire. Once that first case comes, the ER is swamped, our urgent care is swamped. I have patients waiting for treatment.
Once you have it, what's pretty much once you get the flu, and we've all had it, we feel lousy. Is there any kind of hydrate, drink a lot of water? Do we eat more? Don't eat as much? Stay in bed? Get up? What's kind of a protocol for either one of you can answer that? I mean, so once I have the flu, the damage is done. How do I get over it? Some people, it seems like in my office, I have people that are out with the flu for 2 days, and I have people that are out with the flu for 10 days. Is there something they're doing different?
If you catch it in time,
I can tell you the difference.
Of the medicine. What's the medicine if you catch the flu in time?
Well, there's Tamiflu. You can use Tamiflu. Okay. Tamiflu is probably the most commonly used, right? And you can be used in children and adults. The caveat with Tamiflu, you can take it in one of two ways. You can take it prophylactically, meaning you have been exposed to someone who you know has the flu. You're really worried about getting it. You can take it. But also you can take it for treatment. Tamiflu has been shown to reduce the symptoms by about a day if taken within 24 to 48 hours from onset of symptoms. So meaning if you're 3 days into the flu, Tamiflu is going to do you no good.
Okay.
So if whatever your fever started or your body aches and all those symptoms started, you have 24 to 48 hours to start Tamiflu, or it's no benefit.
So then what do you do? Just walk it off, I guess, for lack of a better word?
Tincture of time. Sleep it off.
Sleep it off. So stay in bed.
And stay away from everybody.
Don't go to work.
Don't go to work.
Don't go to work. Hydrate, right?
You have so many people nowadays.
Is it feed a fever, starve a cold, feed a fever? I'm just making sure I can still eat.
Yeah, you can eat, Jeff. You'll be able to eat.
With the flu, just
don't
go ahead
starve yourself, Jeff.
Okay, well then
drink lots of water.
So theoretically, if I get the flu, I don't have to go to work. I can stay at home and eat and sleep.
But you will feel terrible.
Okay.
Yeah.
Gosh. It sounded pretty good at first. I was like, this sounds like my weekend. And we don't mean to be light about it. And I know, Kim, one of the programs that you have with the Spark, and we'll talk about that because admissions into a hospital is no fun. And I did see on the internet where there has been one diagnosed death. So when we are talking about the flu, we do talk about being miserable, but we rarely draw that to a parallel of death. But it happens. Your Spark program is a community-based program. I'd be honored to be on the committee with you. It is designed to help people once they unfortunately get into the hospital, whether it's flu, stroke. As we've talked about, Sumter's a haven for stroke and diabetes. It's to help them go home and stay home. In other words, we educate, we find ways through companies, home health, hospice, ambulance. It's a whole community coming together that you head up. And while we're talking about the flu can put you in the hospital just as easy as anything else. So talk to us about the Spark program. What does that mean? I know you headed up.
Okay, well, Spark, the name Spark came from Jeannie Krotz with NHC here in Sumter.
Okay.
National Healthcare Nursing Home in Sumter. She came up with the acronym of Spark. And bear with me, it is Sumter Partners for Avoiding Readmissions or Unnecessary Readmissions to the Hospital and Continuity of Care. So essentially that group tries to help the hospital avoid readmissions back to the hospital because we are dinged financially now if a patient comes back into the hospital within 30 days of being discharged from the hospital.
For the same diagnosis.
For the same diagnosis.
Right.
The hospital is penalized for that. And then that is spreading out into the community. So home health will be penalized. Nursing homes will be penalized when their patients come back within 30 days. So obviously, and it's not what's best for the patient. So the goal is to keep readmissions down. And then also continuity of care because, the healthcare system is a huge place. And the bigger you are, communication can be difficult. We got hospitalists taking care of community physicians' patients. We've got, patients in the hospital going home to home health. And how do you communicate with home health? This is what I did. This is what I need you to do. It's tough at best. So this community group is a group that comes together quarterly. It's nursing homes, assisted living facilities, DMEs, dialysis, home health, hospice, the hospital, several.
It's a great bunch of people that, and they have one goal in mind. And when you mentioned about the hospitals, people have to realize too, if I have Medicare only, when I go back for this readmission to the hospital, I've got to pay the 20% copay. It's not cheap. And if I also have a job and I'm missing hours, I'm not. So I'm getting a bill, and I'm not getting paid by earning my money during my job. So the hospitals, it's bad for the hospitals. It's bad for the patients. It's bad for everyone. And I think that's what the whole community now has come together and said, how can we help not have these people back into the hospital? It's a lose-lose for everyone. So it's a win-win, your program.
It is. And and I think for the community, it's important to know that we talk. You know, the healthcare system, Tuomey healthcare system, talks with the post-acute providers, the DME companies, all of those that I named. And we talk about, you know, when I send somebody home to you, what am I doing a good job at? What am I doing a bad job at? And when you send somebody back to the hospital from your facility, you know, how can you better communicate with us so we know what it is you need us to do, rather than just patients coming through a revolving door and we're not talking. So great things come out of that meeting. We talked about the last time that I was on the show doing the cipher callbacks. You know, people in the community are getting the callbacks now. This last meeting, Claire Gettings, who handles the callbacks, shared with us some of the information that came out of those calls. One was patients aren't using their incentive spirometers. We aren't encouraging that. So post-op pneumonia, patients have surgery and they don't use their incentive spirometer, do their deep breathing, and when we send them out to the community, they take it home with them. Do we talk to the post-acute providers about encouraging that incentive spirometer? And if not, they're coming back just with pneumonia. It's nursing 101, you all. I mean, it really is. But things fall to the wayside.
She's Kimberly Price, and we're coming up on our fourth break. And when we come back, we're going to talk about the foundation, and we're going to talk about everything that you guys do with your nonprofit organization, and it's a big time of year. So we'll be back with Kim Price for our last segment on Medical Forum.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
This is Brooke Luce, admission instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Reliable medical equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street, voted best prosthetic and orthotic business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with our last segment here on Medical Forum. Been having a great talk, great education with Kim Price, Tuomey Home Health Systems. Her office is on 500 Pinewood Road, 803-773-4663. That's your home health and hospice. And as we talk about hospice, this is a big couple months for your hospice. I know we've got the golf tournament that was originally scheduled in October, but due to the storm, as we all know about, it's been moved to November 6th. I believe Sunset Country Club. Got great sponsors. Guido Hobie and Ems is stepping in this year. Les and those guys do a great job of setting it up. Jeff, of course, very instrumental in setting up there with the foundation. It's a great event. The phone number, what is the phone number there, Kim? Let's do this, 774-9000. Give Tuomey a call, ask for the foundation. I don't know if there are still spots available. It's such a very popular tournament. If there is and you can get in, you'd be a fool not to. And if you miss it this year, you need to get involved with it. I've done it as a representative for 15 years of the 17 it's been around. It not only is the best tournament in town, Dr. Marr, it also does so many things with the funds that it raises to go out into the community and the nonprofit and everything. And Kim, I know coming up even quicker than that, we got some pumpkins going around.
Pumpkins are out today. The hospital, departments decorate pumpkins every year. So today I was in the lobby at the hospital, and as you walk through the lobby and cut that circle and come back around, the pumpkins are out, decorated by each of the departments that participated, and they're quite cute this year.
Is that right? Now, these are real pumpkins?
These are real pumpkins.
Do you put a pumpkin out, Chris?
At home? I maybe.
Did you used to as a kid?
Yes, absolutely. Carved them every year and put a candle in them.
Tell me,
and by the time you carve them a week or two ahead of time, by the time Halloween comes, they're starting to rot already.
A little wrinkle.
If it wasn't cold enough, it wasn't cold enough.
While we're on Halloween, since it's coming up, it's a fun holiday still. I know it's changed a lot since we were kids because we used to trick or treat, go around the neighborhood. Tell me a costume you wore, Chris.
A costume I wore.
Yeah, tell me.
I'm sure. When I was younger, I probably thought about my costumes. As I got older, you just throw anything on and hang out. It was a great way to hang out with the girls in the neighborhood.
Did you ever dress up as a doctor?
I don't think I dressed up as a doctor.
Okay. Kim, you had to be like Wonder Woman one year.
No.
For those that don't know Kim, she kind of looks like Wonder Woman.
Yeah, I think she probably
she does.
She probably could pass for one.
That is a new one. I have not heard that one before.
Yes.
But my mother sewed, so I always had
so you had great costumes. Yeah.
My favorite that I remember, and some people might not remember this person, Raggedy Ann.
Raggedy Ann?
Oh, yeah.
Raggedy
Absolutely.
Ann had an awesome Raggedy Ann costume. Thank you, Mom.
I remember all those plastic costumes that you go and you get for a couple $2 in the drugstore with the plastic masks.
Weren't you disappointed?
By the time you put it on,
and you put that thing on,
it's broken.
and it cut your face.
Dressed up as a nurse.
Did you?
I have. Mm-hmm.
Very good. Next topic. I love Halloween though. Great. Stop by and see those pumpkins. That'd be pretty cool. I'll have to look when I leave here today. We talked about the trees coming up. November, we start getting all the trees for all the sponsors. Is there a cutoff? Do people still have an opportunity to buy one of the trees to be displayed?
Absolutely. We got a little late start this year with the golf tournament
being
pushed back, and also you can buy a tree up into the day that they are all decorated. And if I know Jeff, he would sell you one after they're decorated and help you put it up.
So we need to call the foundation about the trees. Explain the trees again now, because we joke with you about the big tree that goes up early December that Tuomey puts up that you risk your life. And again, great prayers last time Kim was on, and we extend those prayers still to you, Kim, that you don't.
An invitation.
Send us. Here's what I would like with technology. We would like a picture of you on top of that tree from like an aerial shot.
Yeah, that'd be interesting.
Wouldn't that be cool?
Maybe a drone.
We'll see what we can do.
Okay. So the big tree gets decorated in December, and when is the lighting of the trees?
So the weekend after Thanksgiving. So Thanksgiving's on a Thursday. That Sunday,
all right,
Shaw Air Force Base will help us put up the trees.
Okay.
Monday, Tuesday, Wednesday, we will decorate them. That Thursday, which is the 3rd of December.
Okay.
I want to say 5:30 is when we usually have it. There will be in the lobby we'll light the big tree. The big tree is the Circle of Lights tree. So that is the tree that we light in memory of all of the loved ones that we've lost over the year. So the Circle of Lights is where people do a donation and buy a light in memory or in honor of somebody, and we light that tree that night.
Okay.
We light all the trees throughout the hospital that are purchased by local businesses. It's $1,000 for a tree.
And then you can also get someone to decorate, too.
Correct. So to decorate the tree is free. So if you buy a tree for $1,000 and you don't want to decorate it, we can find you a decorator. Or you can choose to decorate it yourself. There's a sign put up by your tree that says bought by whomever, decorated by whomever. So it's a month's worth of advertising. And believe me, the community has come to, they're used to the trees. And people make trips to the hospital just to see the trees. And the patients love the trees.
It's beautiful. And again, reliable medical equipment. We have done that for 10 years too. And it is, if you're a business person, money well spent, because we get comments on it all the time. It is great also for your staff because they go up and decorate it. So it gives them something to do, a sense of pride, sense of advertisement, and it does so much for, I mean, no one wants to be in the hospital, let alone on Christmas.
Right.
And certainly during that time frame. So for $1,000, you set your tree up. I think you guys had 50 last year, Jeff said.
Just over 50 trees last year, right at 51, 52, somewhere in there. And, you know, Grady Locklear is the chair of our committee, so he aims every year to beat the year before. So we are working on it for him tirelessly.
Great. Mar, you got your tree. Do you do a real tree or a Christmas or like an artificial tree?
Oh, I have an artificial tree. Can you get a real Christmas tree around here? I got one from Lowe's one year, but it was the needles fell off a couple of weeks later. It was bare by Christmas.
You have to water them.
I know. I watered it.
So, you know,
I put up
Is this your favorite time of year, guys?
That was your Charlie Brown Christmas
tree. That was my
tree.
Charlie Brown Christmas tree. Absolutely. I love it.
Oh, my goodness. The anti-Kim Price tree was yours. She's got a 30-footer, man, that she needs to be put up on a
I'm going to put
scaffolding.
you all on that tree this year.
You know what? I tell you what. Let's help her. Yeah, and then we can come back and report back to the audience exactly what all went on. But, you know, it's been a great show today. Congratulations again.
Thank you.
On everything that I know your heart and soul is Tuomey Hospital. Anyone who knows you, that goes beyond question. So it's congratulations to Tuomey. Congratulations to you personally on getting over this hump. And it's a settlement. It's not a wrong or right. It is a moving on with everyone's life. Congratulations to Michelle and everyone else to get that done. Great luck with the golf tournament to Jeff, and can't wait to see the Christmas trees. Dr. Mart, you want to have a closing comment on flu season?
Get your flu shot. Get your flu shot.
Get your flu shot.
No reason
Colonial
not to.
Family
Very few
practice.
reasons not to, right, Kim?
That's exactly.
Absolutely.
All right, y'all. I appreciate it. Have a great weekend.
You as well, Jeff. Thanks, Kim.
Kim,
Really appreciate it.
Thank you so much.
Always a pleasure to see you.
All right. Enjoyed it.